CNN did speak exclusively this weekend with the Dr. Fauci equivalent of China. His name is Dr. Zhong Nanshan. And two things stand out from my conversation with him. One, that he was highly critical of the initial response, particularly from Wuhan health officials, saying that essentially they did not tell the truth at the time. Though now Dr. Zhong does support the central government's containment efforts. And the other thing that stands out is that he points out in particular that while things may be opening up here in China and you may be getting a resemblance of what was, that the threat is far from over here.
We are facing a big challenge. It's not better than the foreign countries, I think.
A warning against complacency coming from a man who's gained the respect and admiration of both China's leaders and its citizens. Pulmonologist and China's go-to health expert, Dr. Zhong Nanshan, speaking exclusively with CNN.
We should reopen all the things gradually. On the other side, we still have a very strong control. So the containment of the situation.
Zhong first gained international praise for his work on SARS 17 years ago. His recent focus, COVID-19. He's gained a celebrity status here, many captivated by his physical drive as much as his scientific knowledge. What is it that you have been doing during this period to stay mentally sane, physically fit?
I still keep exercising and sport and all the things, and keep an open mind and eat not too much every time. So that's why I seems to be still can do something in my age of 84.
Some have likened him to the Dr. Fauci of China, referring to Dr. Anthony Fauci, the U.S.'s top infectious disease expert. But within China, they call Fauci the Zhong Nanshan of the U.S.
I cannot compare with Fauci, who is the advisor of the president, always been standing in beside the president.
Perhaps he does not physically stand next to President Xi Jinping, but Zhong has the trust of China's central government. His advice sparks near immediate action. Take, for example, Wuhan's unprecedented lockdown. On January 18th, 5 days before the city was shut down, Zhong traveled to the original epicenter of the outbreak. He questioned the local health officials on the number of cases.
I suppose they are very reluctant to answer my question. The local authorities didn't like to tell the truth at that time.
Publicly, Wuhan health officials as late as January 19th labeled the virus as preventable and controllable. And later, the city's mayor even acknowledged not acting in a timely fashion. Zhong pressed harder for the actual numbers, and when he got them, he headed to Beijing on January 20th. He briefed the central government, and within hours, he was addressing the nation in this live interview on state-run CCTV. Zhong revealed that human-to-human transmission was likely, and as proof of that, he said the virus had already infected multiple medical personnel.
That's a very dangerous signal showing this kind of disease, very contagious.
Within 3 days, Wuhan went into a harsh lockdown that lasted 76 days. Yet even with China's central government now taking the lead, there is still skepticism over the official numbers. Zhong says the Chinese government would not benefit from underreporting.
They have announced one of the steps that all the cities should report the true number of diseases. So if you do not do that, you will be punished. Contribute to the mankind.
Zhong's focus is now on preparing China for a second wave of the outbreak. Over the past few weeks, new clusters of cases have surfaced in several cities, including Wuhan. Do you think a vaccine is going to be a reality in the near future? Where are we with progress here?
I totally believe vaccine is most important to establish this herd immunity.
He cited 3 different vaccine trials underway in China. They will enter their next phases of testing by late summer. But he warns,
if you are going to work out a perfect vaccine, it will take years and years.
We talk so often about the disagreement between the government and the politics at this, but can people find hope in knowing that at least the medical community is able to push past boundaries and that they're discussing this globally?
It's really true in my group, as well as the Guangzhou Institute of Public Health and the Harvard Medical School. I'm very happy to have this opportunity to contact the top hospitals in the world to have some collaboration And then we have made a great progress. And also we have experienced some disease. So 3 months earlier than the US colleagues. So we can tell them some our experience, our lessons.
He is a fascinating character, John, and he's somebody that we, frankly, have been trying to get in touch with for months now. For us to have this opportunity was really rare, and yet at the same time, he's somebody who has risen to that celebrity level here. I mean, you saw behind him, there were several paintings done by children. Those are grade school children who were at home, sending them into his office to kind of pay tribute to the voice that he's had here. At the same time, he's strategic, though. I mean, he doesn't go out and knock the central government and criticize them harshly. He's very focused on his criticism, mostly directing that towards the Wuhan local health officials.
It is interesting, though. He does seem to be at least pushing the envelope a little bit, speaking more freely to you than I might have suspected. David, there is some news overnight about a resurgence of cases in some parts of China. What can you tell us about that?
Well, here's the alarming part, and Dr. Zhong hit on this a little bit when he says, look, people may start removing their mask here, they may start breathing a little bit easier, even reopening businesses, but he says this is far from over. He said it's not over here, even though they feel like they're in the upper hand of containment, and even though state media here portrays things as certainly in a more positive light. He says, look at the Northeast in particular. We're looking at that in certain provinces there where they have enacted Wuhan-like lockdowns recently, where people are now back into isolation and quarantine situations. And then go to Wuhan, the original epicenter of all this. We're starting to see cluster cases break out once again there. And what they've enacted is essentially this city-wide testing. And as of today, we know 400,000 of the roughly 11 million people that live there have undergone testing that will continue for the next few days. It's a massive effort that they're undertaking, and it could likely change the numbers here, assuming things are fully transparent when they're reported ultimately, John.